The speaking test of the Occupational English Test is designed to assess your ability to communicate effectively in spoken English in a healthcare setting. In the speaking test, there will be like 2 role play cards that you have to perform. A role play card is basically they will give you a card, there will be a scenario written on the card, and there will be like a interlocutor or a person who is making the conversation sitting in front of you. They will put a recording device in between you and the interlocutor. You will read the scenario that there is a scenario. Let's suppose there is a patient who is waiting for a surgery of a lipoma on the back, and the patient seemed a bit worried, and then there will be like 4 to 5 tasks written down below the scenario, like reassure the patient that the lipoma is a benign problem, it is not a cancer, it will not grow into the cancer, and ask if the patient is having any concerns. Then they'll be like explain the patient about the follow-up of the procedure, what the patient needs to do, and there'll be like another task like reassure the patient that he will be perfectly fine after the surgery. So like this scenario will be written on the card and the task will be there. The interlocutor will be having a card in his hand as well. On that card there will be written a scenario that asks from the doctor that you have this concern about the lipoma, that you are confused between either it is a lipoma or a cancer. Like all of the questions mentioned on his card, the answers to those questions will be on your card. You will be given like 2 minutes to prepare the role play card, and after the 2 minutes the recording will start and you need to start speaking with the interlocutor. There is no video camera that is recording the footage, there will be just the audio recording. As soon as the 2 minutes gets completed and the conversation will start, you will go on like, "Hello, good morning, this is Dr. Zirak. Could you please confirm your name and age for me?" Then the interlocutor will speak like, "Hello doctor, my name is, let's suppose, Mariam, and I'm 25 years old." So then you go on like, "Okay, Miss Mariam, I can see that you seem a bit worried. What concerns do you have?" Then the patient will go on that, "I have this concern, like it may either grow into the cancer or it is just a benign condition, but how the surgery will go on like that, and what is the post-surgical complication," all of the things that will be mentioned on the card. And whatever the questions written on the card of the interlocutor, the answer to those will be written on your card. You just need to speak those with the interlocutor. So we'll go on like, "I can understand that you seem a bit worried, but let me reassure you that there is no chance that this lipoma will convert into a cancer. We have the best team of surgeons available and they will remove your lipoma straight away, and there will be no chance of there any post-surgical complications of that, and let me reassure you that you will be perfectly fine after that. How does it sound like to you?" So this is the way when you speak such phrases to the patient. It means you are reassuring the patient, and the task on your card was to just reassure the patient. So you are just performing the task that is mentioned on the card. Same way there will be like 4 to 5 tasks that is mentioned on your card, like reassure the patient or explain the patient, change the mind of the patient, or break the bad news to the patient, let's suppose, or check understanding of the patient. So like different tasks will be mentioned on your card, and like there are different phrases that you would speak in different scenarios. When you need to, let's suppose, check the understanding of the patient, there will be different phrases that you would speak, and we need to know what are the criteria on which they are judging our recording, our conversation. If you have the idea that these are the things they are looking for in our conversation, and we will mold our conversation in that way, we can easily score more than good enough in our speaking test. Now I'm going to share with you the criteria on which they are judging our conversation. There are like 10 to 13 things they are looking for in our conversation with the interlocutor. Along with that, I will give you like different phrases that you need to speak depending upon the task you are having. Like if you have the task to reassure the patient, so what is the different phrase that you need to speak in that scenario? Or if they ask you to explain something to the patient, so what phrase do you need to speak in that scenario? So the first thing they are looking for in your conversation is if you use different vocabulary in your conversation or not. So you don't need to speak the same word again and again. You need to change that word somehow. The second thing they are looking for in your conversation is if you check the understanding of the patient or not. So during your conversation with the patient, you go like, "Am I understandable to you? Are you with me so far? Do you have any questions so far?" So like these 3 phases, when you are talking with the interlocutor, in between them you can speak these phrases, so it will show that you are checking the understanding of the patient. The third thing they are looking for in your conversation is if you took the informed consent or not. So in your conversation with the interlocutor, you need to go like, "Do you mind if I ask you about your depression symptoms, like if the patient is having depression, or do you mind if I ask you about that problem? So speaking that phrase shows that you took the informed consent. The fourth thing they are looking for in your conversation is if you validate the concerns of the patient. So during the conversation with the patient, you go on like your concerns are valid. You just need to speak that phrase, or I can understand that how you are going through, or I can understand that must be very difficult for you. So if you speak such phrases, it shows that you validate the concerns the patient is having. The fifth thing they are looking for in your conversation is if either you use icebreakers or not. Like if a patient is talking, he is giving his symptoms, you just in between them go like, I understand that. You need to try to say something in between the patient is when he is talking about something, so that it shows that you are having the conversation with the patient. You are not sitting there blank. The sixth thing they are looking for in your conversation, if you either break the bullet point into more questions or not. Let's suppose there will be a bullet point like ask the patient about his health. So now you need to break the health into more questions, like health has a lot of different perspectives, like physical health, mental health. Then you go on like how about any physical activity that you do, how are you taking care of your mental health. So we just break the one question into more questions. So this way you can easily prolong the conversation, and it just shows your ability to make the conversation with the patient. The seventh thing they are looking for in your conversation, if you reinforce the patient or not. So when the patient is telling you about his concerns, you can simply go on like that, please do not burden yourself. So if you just say this phrase, it goes like you really reinforce the patient. You are with the patient, you really understand the emotions the patient is having. So you just need to memorize such phrases in such scenarios, and they are looking for if you either speak that phrases or not in the conversation. The next thing they are looking for in your conversation, if you are either empathic with the patient or not. So during your conversation you go on like I can understand that must be very difficult for you. If you speak that phrase, it goes like you are empathic with the patient. Or you can't go on like I can understand that how difficult it is for you to go through this. If you speak such phrases, it shows that you are empathetic with the patient. The next thing you need to keep in your mind, that when you are giving suggestions to the patient, you always need to break the suggestion into firstly, secondly, thirdly, fourthly. It just make the thing easier for the patient to digest. Let's suppose there is a task written on your card that suggests the patient to do physical activity and suggest him to take good diet. So when you are talking to the patient, you go like, firstly, I would suggest you to maintain a good lifestyle by doing physical activity. Secondly, I would suggest you to eat a healthy food like vegetables and avoid junk food. So simply you break the suggestion into firstly, secondly, thirdly, fourthly. If there is 4 or 5 suggestions, so you go on like secondly, thirdly, I will suggest you to do like cycling or any physical activity. Fourthly, I would suggest you to do meditation, and fifthly, I would suggest you to go to like morning walk and just like refresh or energize yourself. So you just simply break the suggestion into firstly, secondly, thirdly, and fourthly, and they are looking for it that you did that, and it makes the thing easily understandable for the patient. The last thing they are looking for in your conversation, if you speak grammatically correct tenses. So you just need to speak the tenses in a grammatically correct manner. For that, you just need to memorize some tenses beforehand, like there will be phrases I'm going to share with you. You just need to note down on a notebook, or you just need to memorize that so that you can speak this straight away in the conversation. If you like in the conversation thinking about like different phrases or trying to construct different phrases, there'll be a chance that you speak the grammatically incorrect tense that you need to avoid, so that on the exam day, whatever you are speaking, you have your mind prepared for that it is coming and you will speak like in a fluent and manner way. Now I'm going to give you different phrases that you need to speak in different scenarios. Like if there is a task that asks something or requests some information from the patient, so you speak that phrase straight away. Or if there is a task that explains this to the patient, so how would you start speaking and explaining that thing to the patient? Or if there is a task that changes the mind of the patient, so how would you start or how do you speak that phrase? And we assume that there is a patient by the name Mrs. David, and that patient is having headaches. So this is the scenario in our mind. Now we will perform different task by speaking some phrases. So our first task is to just request some information, ask or find out something from the patient. So we'll go on like, Mrs. David, I would like to find out more about your headaches. Would you mind telling me when they started? So this way you just asked or request some information from the patient. If there is a task to check the understanding of the patient about like a particular medication or determine something, you would speak like, thanks Mrs. David. Now that I know when these headaches started, I just like to check whether you are taking any medication. Can you tell me about your medication usage? So you just ask the question. Now the patient will answer you, and in that way you will determine what you want to know. If there is a task to give some information to the patient or explain, recommend or suggest something to the patient, you would start speaking like, thanks for letting me know Mrs. David. I would now like to explain to you when and exactly how much medication you should be taking. Is that okay with you? So you just need to memorize that phrase so that when anything related to explain or suggest something, you can start speaking like that. Now if there is a task to just change the mind of the patient or to persuade the patient or convince the patient, you would start speaking like, I understand that you might be reluctant to change the medications, Mrs. David, but I want to stress how important this is. You see, the medication you are currently on isn't suitable for the type of headaches you are having. The new medication is much better suited. Do you have any issues with it? So this is the way you speak the phrase and you can try to convince the patient. Now if there is a task to make the patient feel better or reassure the patient or alleviate the concerns of the patient, you would start speaking like, I understand that changing medications can be daunting, Mrs. David. After all, you have been taking the same medication for a quite while, but I want to reassure you that the new medication is much safer and will be much more effective than your current medication. How is that sound to you? So this way you can easily alleviate the concerns and reassure the patient. Now if there is a task to break the bad news to the patient, like the patient was gone through a colonoscopy and he has like now colon cancer, and now you are here to break the bad news to the patient. So we go on like, as you already know, we are here to discuss the results of your like colonoscopy. Then you start speaking like, before moving forward, I would like to reassure you that I'm here to guide you and support you fully at this testing time. Then you take a pause. Then you will go on like, you are diagnosed with a colon cancer. Then you take a pause like for the patient to digest the news, and they will be listening to that if you took the pause after stating the diagnosis or not. And after the pause you would go on like, I know this is not a pleasant situation even with the odds against us. I will make sure that you receive the best treatment medicine can offer. So these are kind of the reassuring words. You just need to memorize that. If you have completed all of your tasks and there is still some time left, then it is a good idea to summarize the conversation. Like you go on speaking like, before winding up this consultation, I would like to remind you what we have discussed so far. And then you go on like, you were having concerns with the lipoma on the back, and I reassured you that it is a benign condition, not a cancer condition, and there is no chance of post-surgical complication. All of the things that you just discussed with the patient. So if you somehow summarize this thing at the end, so it will really add up to the good scores at the end. It is not a necessary thing to do, but if you have time left at then it is a good idea to summarize the thing, otherwise sitting quiet. What you need to do now is a bit of practice. So I'm going to give you a PDF that will be having like a lot of role play cards, and you just need to download those role play cards and start practicing with your friend. So you'll be like the doctor and friend will be like the interlocutor or the patient, and you try to make the conversation with your friend. So like after practicing for like 8 to 10 role play cards, you'll be like good enough in your fluency and your understanding of the different phrases so that you can easily pass the speaking test as well.